What we're going to work on today is what I like to call general elbow pain. We've had tapings before for lateral and medial epicondylitis. And those are very specific injuries. What we have today is an injury in which a patient fell, pretty much landing on the back of the elbow. And though it doesn't, when you palpate, it doesn't feel like it's olecranon bursitis, because there's nothing that's really tender there. If we wanted to, we could put a piece of edema tape that started here and came down and then do the taping that I'm going to show you today. But what we're going to do today is what I like to call, again, general elbow. When I palpate on medial and lateral, okay, and I just squeeze them together, the patient indicates that this is fairly tender. So what we're going to do is have the patient just hold her arm up, and she's holding it with her opposite hand, just completely relaxed as much as she can. Now, we have our tape. With our tape, we're going to now tear our 2-inch end, take that piece off, and we're going to put it above the elbow on the posterior side. Next, we're going to just do paper off tension, and this is going to follow the flow of the forearm around. No tension on the ends, about 5 to 10% tension, again, paper off. That's part one. Part two, exactly the same. Tear the tape, 2-inch piece, okay? Same, tape on the back, and yes, you can put the tape on top of the tape. Just make sure you rub it in very good so it'll stick to itself very nicely. Again, paper off tension, out and around with no tension on the end. Okay, now rub this in place and then test on your patient. Take it out into extension. You should see a little wrinkling on the back, and then let them go back into flexion. There you go. And then go ahead and hold your arm again, please. And then we squeeze these spots again. And when you squeeze, you should have your patient tell you that there is a decreased discomfort or pain in these areas that you palpated the first time. Okay? You should also notice that there will be a functional change in their range of motion and their activity. So remember, clean the skin very nicely. No tension on the ends, 5 to 10% tension, which is just paper off tension on the tape between the ends. And if this is put on properly and the patient takes care of it, this should last upwards of 3 to 5 days.